Hello, and thank you for joining us. Welcome to another edition of Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blakelock, and joining me this episode, I have specialists in emergent care, and we're going to be addressing the emergency department at Heartland Memorial Health. Welcome, everyone.
Thank you.
Dr. Henderson, let's start with you and talk a little bit about the type of typical patients that you might see in the emergency department.
Sure. I would say that they generally fall into three types of categories. There's the truly sick patient who is in danger of dying or decompensating or having loss of limb or something of that nature. There are the patients who, on the other end of the spectrum, are the worried well. Nothing particularly wrong with them, but there's something that might be wrong with them. And then I would say the vast majority of our patients fall somewhere in the middle, where they come in with an ailment that may be of an urgent nature that really needs to be addressed sometime within the next 24 to 48 hours.
Okay. Now, Stephanie Roberts, you're a registered nurse in our emergency department, yes? And you guys typically see a lot of patients, actually, and I don't think our viewers maybe know how many patients you actually see. I have a number of 58,500 patients. That's a lot of people that are coming through our doors at Heartland Memorial, correct?
Yes, ma'am.
So at any given time, those are not just patients from the Hardin County area, correct? We see a regional area.
We see people from LaRue County, Meade County, all the surrounding 7 counties.
Mm-hmm. And actually, too, being off of 65, we see a lot of individuals that may not even be from this area, too.
Yes, ma'am.
So we're one of the busiest emergency departments in our area. In fact, I think, if I'm getting this statistic right, are we not the 4th busiest one? So that's very impressive when we start to think about Kentucky statistics and how many people are actually coming through our doors. Now, Crystal, you're also a registered nurse down in the emergency department too. Tell us, when a person comes in, we've heard a term called triage. What actually does that mean?
Triage basically is when the patient first arrives to the emergency room. The registration will get them into the system via their birthday and their name. The first triage nurse will basically ask them, what are you here for today? How long has this been going on? Or do you have a regular doctor? Then they will go to the second triage nurse where we'll get their vital signs, which includes their blood pressure, pulse, temperature. If we have a bed immediately available, they will go to that bed and the nurse will meet them in there and get their vital signs there. But triage basically is not first come, first served, but who is the most emergent at that time.
Right, and you're able to do that by gathering some information from the patient
their complaints.
And maybe their loved one or somebody that might be with them also, because sometimes they aren't able to communicate.
It's based on their complaints and their vital signs.
Absolutely. Now, that's the walk-in possible. We also have, obviously, the ambulance coming in the back way too. So a lot of things are happening at the same time. Being one of the busiest emergency departments, I think there's been some talk about possible expansion. So do you want to tell us a little bit about that too?
Hopefully in the fall of this year, 2013, we're going to expand the hospital. We will go from 24 beds to 50 beds in the ER. Right now, I think we're supposed to accommodate 44,000 a year, and hopefully with this expansion, we'll go to 75,000 a year.
So we're supposed to be accommodating about 44, but we're seeing over
50.
58. So that shows that need is there drastic to be able to continue our high quality of care that we provide, but also the services and the technology and everything that we need to take care of the individuals. So everybody's been involved pretty much in this expansion project?
We've had nurses, secretaries, the techs, the magistrates from the county, Michelle Murphy, they've all been involved in the design process of the build.
Right. So that'll help, I think, probably for access for individuals that are not only, as we have been, having the walk-in, because we have people that drive to the emergency department, maybe bringing their loved one or sometimes themselves in, and then also the ambulance, coming in through the back. Dr. Henderson, we've been talking about sometimes, maybe we should not drive ourselves to the emergency department. Can you expand upon that?
Absolutely. If you're experiencing any kind of chest pain or shortness of breath, dizziness, something where you feel like you might pass out and become a danger not only to yourself but to somebody else. If you're experiencing any kind of stroke symptoms such as difficulty walking or difficulty with speech, numbness or weakness in any part of your body. Also, if you have abdominal pain that is more than just a bellyache, either it came on suddenly or the severity was such that it was more than just a little indigestion or something like that. Certainly those would be some cases where you could have some deterioration in your condition prior to arriving in the emergency department.
Right.
And it'd be nice to have some of our skilled EMTs and paramedics there to help with that deterioration if need be.
Absolutely. So 911 for some of those symptoms,
Absolutely.
and or make sure you have somebody else there to be with you during that time too. Dr. Henderson, you were talking about stroke, and I know we have some special certifications at Heart and Memorial Health. Tell us a little bit about the stroke certification that Heart and Memorial Health has.
Well, we're a JACO certified stroke center, which means that we can take care of any stroke symptom that you might have. It's particularly important because time is of the essence. If you have any type of stroke symptom, timeliness and evaluation really drives what kind of care we can give you. For instance, if you are eligible for a clot-busting drug or things of that nature, really you don't want to wait and go to sleep and see if this is a symptom that gets better. So we are well versed in stroke, and it is certainly something we're very good at handling.
And have a team that actually would see in the emergency department, and that spreads out throughout the hospital to make sure that that team is really caring for that patient that might be having those signs or symptoms.
Absolutely. It's a case where the whole department knows, including radiology, all the registration, certainly the physicians and the nurses, and we can come in very quickly and get a lot done in a very short period of time in an organized manner. It may seem like chaos to people who haven't done it every day, but it really is very organized.
Right. Now, stroke is part of something that we've heard a term and have used before, I know, on other Health in the Heartland shows, cardiovascular diseases that usually have something to do with our heart. So the stroke head is usually related. Tell us a little bit about something called the STEMI, and that can happen with heart attacks, people that might be actually having some heart attacks. Stephanie?
A STEMI is actually ST elevation myocardial infarction. So that's the major type of heart
Right.
attack.
And that's kind of the big word, myocardial infarction for a heart attack, right?
Right, it is. So we use those as soon as the patient comes in. Obviously, we have to get an EKG. The STEMI, as we call it, shows up on the EKG. So at that point, we are able to activate our STEMI team that we have that is every day delegated to a certain nurse and a secondary nurse. They then act out onto, we have a large process.
Right.
Many people show up, lab, radiology, and this is our first time that we've ever had assigned roles and with our STEMI program.
So the point is the person's coming in with that myocardial infarction, which is really a heart attack. That's the big term for a heart attack and how serious it is. And care is being given immediately to take care of them as quickly as we can with a team that is highly trained in doing so, specializing in a sense in the heart attack care, correct?
Yes.
Wow, that is something that has really taken us to another level as far as the quality of care for the patient. Now, you use the term EKG, and so that's looking at what, the rhythm of the heart?
It is. It's a 12 lead, so there's 12 different leads that are placed onto the body, and it looks at all different views and angles at the heart to determine which heart is affected by the clot that's causing distress. So once we obtain that, the doctor then is able to activate our STEMI alert. So he's the one.
Right. So it sounds to me like things are happening kind of simultaneously because you have to look at the whole person, right, Dr. Henderson?
Absolutely.
To make sure you can make the best judgment as far as their treatment and the care of the patient as you all are working together, doctors and nurses, to take care of that person.